Rushanara Ali.
Thank you, Madam Deputy Speaker. This virus has cruelly taken so many lives. So many of us have lost friends, relatives, neighbours and loved ones across our country. And we pay tribute to all those NHS workers and care workers and others in our country who've paid the ultimate price to protect people. And that is why it's so important that we focus on the areas where we can act to protect our NHS and key workers through ensuring that there's proper, effective and efficient ways of providing them with the testing that's required, so that they don't have to continue with some of the failures that they had to work within, where there was a lack of PPE at the beginning of this crisis, where they had to make incredibly difficult decisions and work under incredible pressure during the beginning of the crisis. One senior doctor, Asian doctor, said to me at the beginning of this crisis in my constituency, we are going to be collateral damage because of some of the things this government is doing. We have to make sure we learn quickly and protect people. I hope that ministers will look at where the mistakes have been made and make sure we learn fast and ensure the testing is provided so that we can ensure that NHS and care workers don't have to put themselves, their colleagues, their patients and their families at risk by not knowing the results of tests quickly. We also know the high death toll among BAME, NHS and care workers, and the government's own inquiry has highlighted the wider inequalities that my honourable friend has already talked about in her speech. We know about the different kinds of family structures, intergenerational families among BAME health staff, those with higher health inequalities and health risks, which means that they are face additional challenges. And so the risk assessments are crucial and testing falls within that framework. So it's absolutely vital that we take action and the government heeds the advice about testing. In care homes, Madam Deputy Speaker, since the end of March, excess deaths have increased by 44% nationally. In care homes, this figure is much higher at 93%. It means 27,000 more people have died in care homes than would normally be the case this time of the year. That is a scandalously high number. So if there is one thing we can do, it's to make sure that the care workers who are there to protect those in care homes are given the testing kits and the testing is done quickly for them too, because they face considerable neglect at the beginning of this crisis. Madam Deputy Speaker, a few weeks ago, the Health Secretary was asked about providing testing in acute settings in the chamber. I asked him and he didn't have an answer and said he would write to me. Despite numerous reminders, I still don't have an answer. Reminders via social media as well as in writing, I still don't have an answer. And I hope the Minister can respond to that point about acute settings in hospitals, because this is something that really concerns people in the NHS. In conclusion, Madam Deputy Speaker, we need to make sure that we learn the lessons quickly, because the risk of a second wave is very grave and very real. And we have to work together to act. And I hope, therefore, the government will heed the advice and ensure that the testing is provided within the timeframe that is necessary to protect people in the NHS and the care service.